What is Parkinsonism, and why is it crucial to understand it? Parkinsonism is a topic that is often talked about but not always thoroughly understood. It's a term you may have heard, also known as Parkinson's syndrome or atypical Parkinson's. But what does Parkinsonism truly encompass? To clarify, Parkinsonism refers to a motor syndrome, a collection of symptoms that play a part in how you move and perform your daily tasks. This term includes symptoms such as rigidity or stiffness, which can cause your muscles to feel tight and resist movement. This stiffness can occur anywhere on your body, making it challenging to carry out simple tasks. Consider waking up one morning to find it harder to get out of bed or to even hold a cup of coffee. That's the stark reality of rigidity. But what is it that actually leads to these symptoms? A key element here is the neurotransmitter dopamine, which is responsible for transmitting signals in the brain that allow for coordinated movements. Parkinsonism is often associated with the loss of dopamine-producing neurons, specifically in an area of the brain known as the substantia nigra. When the substantia nigra loses these dopamine-producing cells, it leads to an imbalance in the brain's basal ganglia, a group of structures responsible for movement and coordination. This imbalance can result in symptoms such as tremors or shaking, which is more than just the common trembling of hands that we may experience when we are nervous. In the context of Parkinsonism, these tremors are often uncontrollable and can be so severe that they hinder normal functions. Another symptom that Parkinsonism encompasses is bradykinesia, a medical term for slowed movement. This isn't just moving a little slower than usual. Bradykinesia is a drastic slowness in voluntary movement. This symptom too is the result of the loss of dopamine-producing cells and the subsequent disruption of normal communication within the basal ganglia. Understanding the pathophysiology of Parkinsonism is essential in comprehending why it's crucial to be familiar with this condition. Parkinsonism is the central feature of Parkinson's disease, which is the leading cause in about 80% of Parkinsonism. But Parkinsonism isn't just synonymous with Parkinson's disease, it's a broader term that includes several conditions which demonstrate similar symptoms. Parkinson's disease, the most well-known of these conditions, was first described by James Parkinson in the year 1817. Since then, our understanding of it and the broader concept of Parkinsonism has evolved significantly. We've conducted extensive research and numerous clinical trials to decipher these diseases' mysteries. Understanding Parkinsonism is important for not only the individuals affected and their families, but also society as a whole. Awareness and comprehension of Parkinsonism can lead to better support, more research funding, and eventually a cure. It's a complex disorder with a wide range of symptoms, but with knowledge and compassion, we can work collectively towards better solutions. So what is Parkinsonism and why is it crucial to know about it? Simply put, it's because knowledge is power, and power can lead to empathy, support, and ultimately a cure for these debilitating conditions. Other causes of Parkinsonism include a variety of secondary factors. For example, there's normal pressure hydrocephalus, a condition where fluid accumulates in the brain. There's also vascular Parkinsonism, which is due to stroke or other vascular conditions. Drug-induced Parkinsonism, as the name suggests, is caused by certain medications, while toxin-induced Parkinsonism is linked to exposure to industrial toxins. There are also rare causes like brain tumors, chronic traumatic encephalopathy, and juvenile Parkinsonism. Understanding the pathophysiology or the functional changes that accompany Parkinsonism is vital. The extrapyramidal system, a network of structures in the brain that help regulate and control movement, plays a crucial role here. This includes the